What are the fertility considerations with adjuvant therapy? When you are considering adjuvant therapy for your melanoma, there are two main considerations. One is pregnancy prevention, and the second is future fertility. First, I'd like to talk with you about pregnancy prevention. We really don't know all the effects on a fetus with either of these class of drugs. And therefore, because of that, pregnancy prevention is key. You need to have a discussion with your provider about the acceptable forms of birth control, as some that you may be currently using may not be acceptable. For example, for patients who are going to go on dabrafenib and trametinib, they must use a non-hormonal form of birth control due to the drug-to-drug interactions. If you are a male who can father a child, you also need to consider pregnancy prevention and the transmission of sperm to a female to try and keep them from getting pregnant. The second issue is that of future fertility. If you are planning a family in the future, we really don't know all the effects on future fertility. And I think this is something that all patients should have a frank conversation with their provider about. You can ask to speak to a fertility specialist who may offer up suggestions based on your situation for potential banking of sperm, freezing of eggs, but these all need to be considered on a case-by-case basis and discussed with both your oncology provider as well as a fertility specialist. Even though the products may vary between immunotherapy and targeted therapy, as a general rule of thumb, we recommend our patients wait a minimum of 6 months after discontinuation of therapy prior to trying to conceive.